Good evening and thank you for joining us. The township of Ignace is facing a crisis of democracy.
Several recent council meetings have been cancelled without explanation, and citizens there are worried about dysfunction among the mayor, councillors, and town staff. Lee Noonan was in Ignace yesterday speaking with residents there, and she joins us live in studio. Lee?
Thank you, Riley. We have reached out to all 5 members of Ignace Council, and so far, none of them will talk to us, so there's not much we can confirm about what's really happening. For the residents we spoke with, that lack of transparency is not a small part of the problem. Ignace OPP confirmed they were made aware of a situation at the local municipal office on March 10th, but that no charges were laid. They suggest the matter was a labor issue. There are 5 members of Ignace Council, including Mayor Bill Gascon, all elected in October when the previous council was all voted out. None have responded to requests for comment. Residents of Ignace say that with rumors and accusations flying in all directions and little official information available, they don't know what's going on at Town Hall, and they're losing confidence in their leaders.
There's so many stories out there and you don't know whether half of them are true or not.
There's no accountability. They all ran that, everything would be seen, and we don't have any idea what's going on.
Mom and Dad are fighting and disputing and can't get along. It affects the children. And so it's affecting us people.
I've been having actually sleep problems lately, like lots. And, thinking of selling my house because, we're all questioning, we're crying for help here, actually. And nobody's coming.
They have to figure this one out, right? They have to build the confidence. They have to build the expertise within their own council. That's their job and that's their mandate. And I want to see them do that. I don't care who's sitting there. I just want to make sure that they do their job.
One thing that does seem clear is that Ignace Council is divided. A release issued by the township states that 3 councillors have, quote, stepped in and taken a stern position to protect and enforce their obligations to protect employees. No clarification has been offered as to what that position is or what may have motivated their actions, with the town clerk saying the township's lawyers have advised council and administration not to comment on the matter. Meanwhile, in a Facebook post, Mayor Gascon asserted that he does not believe all councillors are doing their due diligence so they can make proper decisions that are in the best interest of the residents of this community. In another post, the mayor refers to difficulties in getting enough councillors to attend meetings and concerns that important opportunities could be missed. The statement issued by council included a commitment to bringing together all 5 council members for training on their roles and responsibilities. There's no indication so far as to when that might take place. Lee Noonan, TBT News.
The Thunder Bay Regional Health Sciences Centre has announced some major changes to its COVID-19 protocols. The hospital is transitioning out of its pandemic response, but mandatory masking will continue for the time being. The 3 big changes will begin tomorrow. Each inpatient will now be able to identify up to 2 essential care partners and 4 care partners at admission, which can be changed throughout the patient's stay. 2 people can be present at the bedside at any given time. The internal pandemic response levels will be discontinued, and the current orange level restrictions will no longer be in effect. However, a restricted state will still be utilized if protective measures are needed, and there will be no longer screening booths at the hospital entrance. Instead, people will be asked to self-screen and not enter if they have COVID symptoms.
Starting tomorrow, the Ford government will discontinue health coverage for those without an OHIP card.
The card hasn't been required throughout much of the pandemic, and as Mike Lang reports, healthcare providers in the region strongly disagree with the change, fearing the worst for vulnerable populations.
So I think it's completely unreasonable to ask physicians to subsidize the health care of people in this province.
Dryden physician Stephen Viher-Yoki's concern could become a reality. He says that many of those who don't have OHIP cards either live in remote communities, are part of vulnerable populations, or are non-Ontario residents. With the province cutting off coverage to those people, Viher-Yoki fears that the only way they can receive the care they need is if healthcare practitioners provide it on their own accord.
Relying on the goodwill of physicians who feel they need to provide care is inappropriate, and really the province should step up here.
In more populated areas like Thunder Bay, health centers must accommodate an even greater volume of impoverished patients. Norwest CEO Juanita Lawson says it's not easy for those in unstable living conditions to apply for and hold on to a health card.
Those are things that I think many of us take for granted, but those are also things that many individuals struggle with obtaining, even though we think that accessing healthcare is fairly simple. It's not for many people.
Registered midwife Rebecca Hautala says it will cause those patients to further delay treatment, leading to worse health outcomes.
Not having comprehensive health care for everybody is just really not equitable, and it's not okay. They suffer because of the long-term outcomes of not receiving care early enough that we can actually provide interventions to improve their health care, and their overall health in general is going to just cost the person, the community and society and the healthcare system more money eventually.
We would want some reconsideration with regards to this decision and some time for communities to be prepared to take a look at where uninsured funding can be placed, to look at expanding team care models to again support people who need this care.
The policy to provide health care only to those insured with an OHIP card takes effect on Saturday. Mike Lang, TBT News.
The province has set the terms of this year's increase to the minimum wage. Starting October 1st, the general minimum wage for most workers will increase from $15.50 an hour to $16.55. The student minimum wage goes up $1 to $15.60. The increase is tied to Ontario's Consumer Price Index. The Ford government says it will mean an annual pay jump of nearly $2,200 for full-time workers. Critics say it still falls well short of a living wage, especially in the GTA.
Oral health advocates had a chance to meet with a local MP today to discuss how the recently tabled federal budget is benefiting the dental sector.
Patty Haidu was at a Thunder Bay dentist's office today to highlight her government's newly announced dental care benefits. Vasilios Bellos reports.
The Liberals' 2023 federal budget comes with it some significant investments into dental care across the nation. Included in that is $13 billion over 5 years and more than $4 billion ongoing to implement the Canadian Dental Care Plan. It will provide dental care for uninsured families making less than $90,000 annually, with the rollout beginning this year. Thunder Bay Superior North MP Patty Haidu sat down with some local oral health advocates to help them better understand how these federal dollars could benefit the patients they serve.
It's an exciting time because it means that oral health, dental care is going to be considered just as essential as all the other kinds of health care that is covered under our universal health care system. To make sure that the ability to pay is not the defining feature of whether or not you can afford a healthy smile.
Working in dental, we do work with people that we see daily with barriers to funding, and that does prevent them from seeking dental care.
The funding is meant to build on the Canadian Dental Care Plan introduced last year. That provides parents with direct, upfront, tax-free payments to cover dental care for children under 12. Local dentist Dr. Derville Clark says this, along with the new funding in this year's budget, means they can catch patient health concerns before they become serious.
Often you have to treat it with crowns or implants or big fillings and so on and so forth. A lot of those problems can be prevented with simple preventative oral care, and this is what I think that program allows. It allows a child to visit the dentist twice a year and catch problems before they really manifest into something that becomes more expensive.
Vasilios Bellos, TBT News.
A big funding announcement for St. Joseph's Care Group today. MPP Kevin Holland says the provincial government will invest $1.4 million into St. Joe's to help expand its chronic pain management program.
I'm excited to announce $1.4 million investment annually to St. Joseph's Care Group's chronic pain management program. So, congratulations.
The program serves people in northwestern Ontario who are experiencing ongoing pain that hasn't improved with other treatment. The funding will go to more staff, allowing for more than 200 additional clients per year and decrease appointment wait times. CEO Kelly O'Brien is grateful for the government's investment. She says it will allow St. Joe's to provide clients with the appropriate care that they need to deal with their pain.
It's really an exciting day for us to have learned of the $1.4 million from the ministry and from MPP Holland today. We actually take a holistic approach, and that's why we have an interprofessional team who work with the client, meet the client where they are, and help them develop the skills to manage and understand what they're experiencing and strategies to manage that.
The need in Thunder Bay for the chronic pain management group was it was an easy decision for our government to get behind and support the program. So the $1.4 million investment that we were announcing today is going to go a long way to improve the quality of life for those that are dealing with chronic pain and trying to manage that pain. So I couldn't be happier to make that announcement and to support St. Joseph's Care Group and the great work that they're doing.
The Indigenous Law and Justice Institute at the Lakehead University Law School hosted a special event today. Indigenous organizations like Treaty 3, NAN Legal Services, and Nokiwin Tribal Council were invited to express the needs of their community when it comes to revitalizing Indigenous care. The Indigenous law, the conference included presentations to help increase knowledge and awareness of Indigenous laws and legal traditions. It was also about keeping an open dialogue and listening to each community's needs and concerns. Here are the co-directors of the Indigenous Law and Justice Institute.
Just to share with them, we're hoping to host them, treat them well, and find out really what they want in their communities in terms of Indigenous law revitalization.
Really important for us not to be the drivers of the work, but for communities to be the drivers of the work. And so that's why we work in this way, which is to consult with community, see what they want and what they need, and then we go from there.
This is the first such event, but more will follow. Sutherland says they were inspired by a similar conference by the Wakotewin Law and Governance Lodge, and they hope to build on what they've learned.
With the snow melting away and spring right around the corner, it's a great time to get a head start on turning the backyard into the envy of the neighborhood. The 25th anniversary Spring Home and Garden Show is taking place at the CLE grounds this weekend. With this being the first time the event has been held in 4 years, locals turned out en masse to see everything this year's show has to offer. There's more than 100 booths featuring everything to do with backyard and home renovations, from barbecues to granite countertops, along with numerous food vendors. Co-chair of the Home and Garden Show, Peter Marsh, believes the crowds will only continue to grow throughout the weekend.
Yeah, it's been like a sleeper. All of a sudden we're awake. Thunder Bay's back, and so is the Home and Garden Show. It's pretty well packed, and I think it's going to be like this all weekend. This is Thunder Bay, and we're pretty resilient. So I think it's going to be awesome, this show.
The Home and Garden Show will run until 9 o'clock tonight, 10 to 6 tomorrow, and 11 to 4 on Sunday. Admission is $5.
The Regional Health Sciences Foundation's Thunder Bay 50/50 draw has made another millionaire. Kitchener's David Sloan got the life-changing call today, notifying him that he's won more than $1.5 million.
I think I'm going to faint. You're not, you can't be.
And why would you faint?
Because I've been playing your lottery for quite a while and hoping that I would win. And I just looked at at my email thread, and it was saying that it was up to 1.5.
David, you have won $1,511,855.
I had to come outside to take the call. I'm on my back porch and I'm sitting down. I just crouched down so that I don't fall over. You're not kidding me, right?
No, it's no joke. Sloan says he's been working for 40 years and didn't know when he'd ever be able to retire. He notes he and his partner have been hoping to buy a house, but he wasn't in a position to do so until now. The prize is the largest ever awarded outside the month of December. The Thunder Bay 50/50 draw has issued more than $21 million in prize money since its inception. Tickets for April's draw are on sale now.
Meanwhile, there's another new millionaire in Thunder Bay. A local woman has struck it rich playing Lotto 649. Ann Carlson took home $1 million in the February 1st Gold Ball draw, which happens in conjunction with the Classic 649 draw. The retiree says she was at a loss for words and felt very humble when she realized she had actually won. Carlson says she plans to share her good fortune with family and friends, as she's always wished she had the means to give people a helping hand, and now, well, she can do that.